Before starting your talquetamab treatment, make sure to read the medication guide provided by your pharmacist. It's important to carry the patient wallet card with you and show it to all your healthcare providers. Talquetamab is given by injection under the skin, usually in the abdomen or thigh, as directed by your doctor. The initial dose will be low and gradually increased to reduce the risk of side effects. You will need to stay in the hospital for 48 hours after each dose increase so your doctor can monitor you closely. The dosage and treatment schedule will be based on your medical condition, weight, and how you respond to the treatment. Before receiving talquetamab, your doctor may prescribe other medications to help prevent side effects and infection. Follow your doctor's directions carefully for all your medications. Some common side effects of Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution may include tiredness, nail problems, muscle/joint pain, loss of appetite, weight loss, dry mouth/eyes/skin, or diarrhea. You may also experience pain, bruising, redness, itching, or swelling at the injection site. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. You may also experience pain or sores in the mouth and throat. To alleviate these symptoms, it's recommended to brush your teeth carefully and avoid using mouthwash that contains alcohol. Rinsing your mouth often with cool water mixed with baking soda or salt and eating soft, moist foods may also be helpful. Although serious side effects are possible, your doctor has prescribed this medication because the benefits outweigh the risks. It's important to be mindful of any changes in your health and to communicate promptly with your doctor if you experience any serious side effects. Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution may lower your ability to fight infections, making you more susceptible to serious infections. It's important to seek medical attention if you notice any signs of infection such as a sore throat that persists, fever, chills, or cough. During treatment, this medication may cause skin problems such as redness, rash, or small bumps. It's important to notify your doctor if you develop any rash, as it could be a sign of a severe reaction. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so it's important to communicate with your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting talquetamab, make sure to inform your doctor if you have any allergies or if you have had recent infections. This medication can cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana as they can worsen these effects. It's also important to be cautious around people with infections, and to avoid contact with anyone who has recently received live vaccines. To lower the chance of injury, be careful with sharp objects and avoid contact sports. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using talquetamab, and discuss reliable forms of birth control. It is not recommended to breastfeed while using this medication. When taking Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help ensure the safe and effective use of Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center. Before starting to use Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution, it is important to undergo lab and medical tests, such as a complete blood count, liver function test, and weight check. These tests should also be conducted while you are using this medication. It is crucial to keep all medical and lab appointments and consult your doctor for more details regarding these tests. It's crucial to take each dose of Talquetamab-Tgvs 2 mg per milliliter subcutaneous solution as directed by your doctor. If you happen to miss a dose, make sure to consult your doctor or pharmacist immediately to establish a new dosing schedule. This medication is administered in a medical facility, such as a hospital or clinic, and it is not intended to be stored at home. Therefore, it is important to consult with your healthcare provider for further information regarding the administration and storage of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.